Assalamu alaikum friends. Hope all of you are fine and doing well. Today in this video I am going to discuss about the muscles of hip joint. Before this video I have already made videos on knee joint muscles and ankle joint muscles. I have given the links of both videos in description box. You can watch after this video. In this video, I organized this slide into four parts. First, we will discuss flexors, then extensors, then abductors, and finally adductors muscle. So let's start this video. The first muscle that is involved in hip flexion is psoas major muscle. The muscle in green is psoas major muscle. Its origin from bodies of T12 and all lumbar vertebra and bases of transverse processes of all lumbar vertebrae and lumbar intervertebral discs. Insertion on lesser trochanter. The muscle in green is psoas major muscle. Nerve supply. Anterior rami of lumbar plexus. Action involved in hip flexion and lumbar spine flexion. This is the psoas major muscle. Second muscle that is involved in hip flexion is iliacus muscle. The muscle in green is iliacus muscle. Origin from iliacus fossa, iliac crest, ala of sacrum, and sacroiliac and iliolumbar ligaments. And insertion on blends with insertion of psoas major into the lesser trochanter. This is the iliacus muscle. Nerve supply, femoral nerve. Action, flexion of hip and trunk. Iliacus muscle involved in hip flexion and trunk flexion. The third muscle that is involved in hip flexion is rectus femoris. Origin, it has two heads, straight head and reflected head. Straight head origin from anterior inferior iliac spine and reflected head area above acetabulum capsule of hip joint. The muscle in green is rectus femoris muscle. Insertion base of patella then forms part of patellar ligaments. This is the rectus femoris muscle. Nerve supply, femoral nerve. Action involving knee extension and hip flexion. Rectus femoris muscle involved in hip flexion and knee extension. The fourth muscle that is involved in hip flexion is sartorius muscle. Its origin anterior superior iliac spine and area just below. The muscle in green is sartorius muscle. Insertion upper part of medial side of tibia. Upper part of medial side of tibia bone. Nerve supply, femoral nerve. Action involved in hip flexion and knee flexion, laterally rotation and abducts hip, medially rotation, tibia on femur. The muscle in green is sartorius muscle. Then last muscle that is involved in the hip flexion is pectineus. Origin pecten pubis, iliopectineal eminence, and pubic tubercle. Insertion along a line from lesser trochanter to linea aspera. The muscle in green is pectineus muscle. Nerve supply, femoral nerve, and occasionally accessory obturator nerve. Action involved in hip flexion and hip adduction. The muscle in green is pectineus muscle. It is involved in hip flexion and adduction of hip. Let's discuss the muscles that are involved in hip extension. The first muscle is gluteus maximus. Its origin from ilium, posterior gluteal line, posterior border, adjacent part of the iliac crest. Second, aponeurosis of erector spine, then sacrum posterior aspect, and then side of coccyx, then sacrotuberous ligament, and then gluteal aponeurosis. The muscle in red is gluteus maximus muscle. Insertion on iliotibial tract of fasciolata and on femur on gluteal tuberosity. Nerve supply inferior gluteal nerve. Action involved in hip extension and lateral rotation and abduction of hip. It is involved in hip extension, lateral rotation and abduction of the hip. The second muscle that is involved in hip extension is semitendinosus. Its origin ischial tuberosity, insertion, tibia, upper part of medial aspect. Nerve supply, tibial division of sciatic nerve. Action, knee flexion, hip extension and medial rotation femur. This is the semitendinosus muscle. It is involved in the hip extension, knee flexion and medial rotation. Now, semimembranosus. Its origin from ischial tuberosity, insertion, posterior aspect of medial tibial condyle. Nerve supply, tibial division of sciatic nerve. Action, knee flexion, hip extension, and medial rotation of tibia on femur. This muscle is the semimembranosus muscle. It is involved in the hip extension, knee flexion, and medial rotation of tibia. Next muscle that is involved in hip extension is biceps femoris muscle. It has two heads, long head and short head. Long head origin from ischial tuberosity, sacrotuberous ligament. Short head origin from lower part of lateral lip of linea aspera, lateral supracondylar line of femur, lateral intramuscular septum. Insertion head of fibula, lateral tibial condyle. Nerve supply sciatic nerve, long head, tibial division, and short head, common peroneal division. Action involved in knee flexion, hip extension, and lateral rotation of tibia on femur. It is involved in hip extension, knee flexion, and lateral rotation of tibia on femur. Now discuss about the muscles that are involved in abduction of hip. The first muscle is gluteus maximus. Gluteus maximus origin, insertion, nerve supply and action have already discussed above in this video. So move to next muscle. Gluteus medius. Origin gluteal surface of ilium between posterior and anterior gluteal line. Insertion greater trochanter. Nerve supply superior gluteal nerve. Action involved in abduction and medial rotation of hip. The muscle in red is gluteus medius muscle. The next muscle that is involved in hip abduction is gluteus minimus. Origin ilium, gluteal surface between anterior and inferior gluteal lines. Insertion anterior lateral ridge on greater trochanter. Nerve supply superior gluteal nerve. Action involved in abduction and medial rotation of hip. Then the sartorius muscle that is involved in hip abduction have already discussed above in this video. So move forward. This is the sartorius muscle. Then tensor fasciata. Its origin from outer lip of iliac crest between iliac tubercle and anterior superior iliac spine. The muscle in green is tensor fasciata. Insertion iliotibial tract. Insertion on iliotibial tract. Nerve supply superior gluteal nerve. Action involving knee extension, abduction and medial rotation of hip. Involving knee extension and abduction and medial rotation of hip. Then piriformis muscle that is involved in hip abduction. The muscle in green is piriformis muscle. Its origin from front of second to fourth sacral segment, gluteal surface of ilium, pelvic surface of sacrotuberous ligaments. Insertion medial side of greater trochanter. Medial side of greater trochanter. Nerve supply anterior rami of sacral plexus. Action laterally rotation and abduction of hip. Now discuss about the adductors muscle. The muscles that are involved in adduction of hip. The first adductor muscle is adductor longus. Its origin front of pubis. Insertion middle third of linea aspera. Nerve supply anterior division of obturator nerve. Action hip adduction. The muscle in green is adductus longus muscle. The second muscle is adductor magnus. Its origin from inferior ramus of pubis, conjoined ischial ramus, inferior lateral aspect of ischial tuberosity. Insertion linea aspera, proximal part of medial supracondylar line. Nerve supply obturator nerve and tibial division of sciatic nerve. Action hip adduction. This is the adductor magnus muscle. Third muscle that is involved in hip adduction is adductor brevis. The muscle in red is adductor brevis muscle. Origin external aspect of body and inferior ramus of pubis. Insertion upper half of linea aspera. Nerve supply obturator nerve. Action hip adduction. Then gracilis muscle. The muscle in green is gracilis muscle. Origin from pubis, anterior ramus and lower half of body and adjacent ischial ramus. Insertion on tibia, upper part of medial aspect. Nerve supply obturator nerve. Action involving knee flexion, abduction of hip and medial rotation of tibia on femur. Then pectineus muscle that we have already discussed above in this video. This is the pectineus muscle. Thank you for watching this video. Please like, subscribe and share my channel.